Hi, this is Dr. Ortega at Spectrum Aesthetics. People ask about drains, and what are they for? Well, number one, they're to remove fluid that accumulates underneath the tissues that we've operated on. In particular, tummy tucks and breast lifts and reductions, there's always some serum and blood that collects under the skin, and we need to evacuate it so it doesn't form something known as a seroma. This is a demonstration. As you can see, the drain is coming in here, drain. Here it says groin. This is for the tummy tuck, for example. And this is where your incision would be. And here's the drain, but it would be obviously hidden underneath the skin. The purpose being to evacuate the fluid that would be here. And the drain looks like this. This is a bulb that connects to the tubing that's part of the drain. I'm going to flip this and show you. The drain is part of this whole tube, and this has a bunch of little holes, and the fluid gets into this part of the drain and then gets collected through the tubing and comes to here. Now you'll notice I have a knot in this tube. That's not the way it normally is, but in order for demonstration purposes, in essence, as long as this drain is underneath the skin, you will have a vacuum. If you see the drain looking like this, you no longer have any vacuum. Therefore, when you see it filled with liquid looking like this, you have to uncap it and measure the volume that has little lines here that allows you to measure it. And once you've documented how much you have, then you're free to eliminate it by squeezing it out through this little nozzle here. And then you keep it squeezed and you recap it like this. And voila, that's French for magnificent. You know, look at, there it is. The bulb is collapsed again, and it's creating a vacuum again along the tubing underneath the drain. So, how long do they stay in? Well, for tummy tucks, I ask patients for 2 weeks. Why? Because it's been my experience that drains left in less time, you have too many incidents of seromas forming, and there are conditions that are not life-threatening, but they are certainly annoying, and they require further intervention, which could require a return visit to the doctor. And if you live far away, that's the last thing you want to have to do. Also, they also delay healing. Like in the reasons for breast surgery that I use them, it's because the fluid, as little as it may be, it tends to cause prolonged swelling in those tissues, and I found that by using them I have less incidence of that healing problem. So they're not left in as long, 4, 5, 6, maybe top 7 days, but they do help, that's why I use them. When I didn't use them, the patients seemed to have more swelling and sometimes delayed healing and wound separation. So I don't like to see that, obviously, and nor does the patient. And as far as once you remove them, I'm going to show you here how we do that. So as you can see carefully here, there's this little blue stitch that's tied around. Notice it's holding it from coming out. But if I snip the stitch right there, you see that? That's going into the quote-unquote skin. Snip. Now, with gentle pressure, drain is removed. And of course, there's still a hole there. What do you do with that? You cleanse it, you put a little antibiotic ointment on it, you cover it with an absorbent pad, and you allow Mother Nature to heal it for you. Usually it will be closed by less than a week's time. And it doesn't really leave much of a mark. And that's how you handle drains once they've been removed. Now, who can remove a drain? Persons who have some knowledge of how to use these devices are capable of doing this for you. I don't recommend that the patient herself or himself pulls out his own drain, because you're at a major disadvantage from a position standpoint. And I think it should be someone who has some experience. So you can ask your primary, you can ask your OBGYN, if you have friends that are nurses and have experience with this and they're willing to, you can do that as well. But timing is important, so don't get anxious to take it out sooner just because it annoys you. You'll get much more annoyed if you get a seroma, because then you'll have to see me again. And although I'm a nice guy, I prefer not having to treat seromas, just like you would not want to be treated for a seroma. So prevent it from happening, and then you don't have to deal with that. So that's pretty much drains in a nutshell. Hope it's been helpful.